And we are live. Welcome back, everyone, to One Topic at a Time. Today, that topic is going to be social determinants of health. We recently mentioned social determinants of health briefly in episode 5 of our men's health series, part 1. Part 2 comes out this Tuesday on the 27th. We drop episodes every week on TMI Tuesdays at 10 a.m. Eastern. You can find us on your favorite podcast apps as well as YouTube. This Tuesday will be the 27th of June, and it'll be our last episode for the month of June. We have 4 more episodes left for this season 1, our first episode. And so we have a special guest coming on for our diabetes episode in July. We're asking that you send us your questions for him. He is a pharmacist and a diabetes educator. You can send those questions to our email, which is tmi.melanin@gmail. And that's going to be in the description box, as well as all the links for our social media accounts. So it's for today, we're going to keep it simple, but I'm also going to introduce a new feature that we received feedback on that would be really nice, particularly for some of the more complex topics. So I'm going to use this as an opportunity to play around with that. We're going to be filming over the weekend, and so I wanted to kind of test this out and see how it works. So here is social determinants of health. So for instance, when you get paid, you spend some of your money on your housing, your food, transportation, maybe some entertainment, and then healthcare. Generally speaking, the younger you are, the less you might spend on healthcare, depending on your desires and your lifestyle. And then we might see that as people get older or they get diagnosed with certain diseases or those diseases start to progress, that they tend to spend more money on healthcare. And so just like you spend money on certain things, the country spends money on certain things, the government. And when we look at the United States and compare the United States to other equally high income countries, the United States spends the most on healthcare. And you would think that that equals better health outcomes. But unfortunately, that is not the case in a number of categories. And so we started to look at what's contributing to these causes, what's contributing to this outcome. And so instead of saying, let's look at what we have right now, let's take a few steps back and see how we got here. And so sometimes you'll hear people refer to it as going upstream to try to make some changes that we're seeing downstream. So in particular, in episode 5, when we talked about men's health, we talked about the number one cause of death in men is cardiovascular disease or heart disease, things affecting your blood vessels and your heart. Well, what's causing that? So we have a few categories that we've looked at that are big contributors to your health outcomes. We look at where you live, where you work, where you play, and where you age. We looked at those and saw that they have the greatest influence on your health. And also we noticed that when we look at the data, because numbers really matter, that what we're doing in healthcare only equates for about 10 to 20% of your health outcome. And that there's these other factors that play a much bigger role than what we're doing. And so we had to start getting involved outside of the clinical setting so that we can see better outcomes and so that you can have a better quality of life. And so I'm going to go to this other slide here. So let's look at the different categories. We look at money, right? So if I tell you that you have high blood pressure and you need to make some changes, or else I'm going to prescribe this medication. So what are the changes I want you to make? I want you to adjust your diet. I want you to work out more. Okay, so now you're going to go home and you're going to try to implement this in your lifestyle. So let's look at economic stability. So employment. Well, we know that if people don't have the money for a car, or they don't have enough money for housing, or they don't have enough money for food, then they're probably not going to be able to spend money on getting a healthier option, because we all know, at least here in America, that sometimes it costs more to live healthier. We know that smoothie costs more than that candy bar, and that the salad costs more than a burger and fries and a soda. And so when we look at employment, people need to take care of themselves and their family. That's going to be top priority, right? So they need to be bringing in more money than they owe people, right? Assets and liabilities, income versus debt. So we know that if people are not in a place to get good employment where they can actually meet their needs, then more than likely they're not going to be able to do what we're asking or do what they desire for their life. If they're so busy working just to make ends meet, to pay high expensive medical bills, to pay for child support, then how much money is going to be left to spend at the grocery store or for a gym membership? So then let's go to the next category. Neighborhood and physical environment. So I say, you need to lose weight. I want you to walk 30 minutes a day, most days of the week. Over time, increase the distance as you increase your tolerability. Well, we know that some neighborhoods have sidewalks, and it's very safe to go walking early in the morning, middle of the day, late at night. There's adequate lighting, there are crosswalks and stop signs. So it makes it very comfortable, and people feel very safe going out. Not every neighborhood is like that, particularly when we start to look at our communities where our Black and Brown citizens live. There may not be safe housing, there may not be adequate sidewalks, there may not be appropriate stop signs or stop lights. There might not be good signs for cars in terms of slow down around this corner. There's children who play here. Playgrounds, green spaces. The data shows that if you live in a place where there is lots of green space, you're more than likely to have less rates of asthma. When people don't have asthma, they can run, they can walk, and feel really good in their body. Even if you have those things, we do have medications to treat them. But we also notice that when there's green spaces, there's less landfills, there's less pollution. The people in the community tend to do a better job at making sure the space is clean and that people are not exposed to toxic chemicals that might impair their ability to breathe safely. And so we have walkability score. That's something you can actually Google whenever a lot of times when people move or look for a new place to live, they might look up a walkability score. Even in travel, I'll look at that to see, will I need to rent a car or can I use a bike to get around or a scooter? Let's go to education. So we know that what we're trying to do here at the podcast, at the Melanin Initiative podcast, is health literacy. And that really has a lot to do with language. The words that we're using, how we're delivering those messages, right? Not just me understanding it because I've been in healthcare for X amount of years, but I need to make sure you understand it because you're going to go home and be in charge of your body. You're going to be in charge of your health. So how am I communicating that message to you? How am I communicating that message to you when we're one-to-one, when it's online, when you visit social media, when you are Googling information yourself? Are we speaking the same language? Am I using English? Is that your primary language? Do we need a translator or an interpreter? Do I need to make sure my website has the ability for you to translate it into your own language? Excuse me. Early childhood education. Everything starts back to childhood. It's so important to start building those building blocks at an early age. We see that the more education someone receives, typically the higher their health literacy. That's not always the case. Not everyone goes off to college. Not everyone who's successful needs to have multiple degrees. We know particularly our business owners and our entrepreneurs definitely defy that myth. But also when it comes to education, nowadays there's so much information online. All you have to do is just check is it credible? Is it a credible source? But you can learn, and we know people are going to YouTube University and ingesting a lot of content there. So even if we don't have those things in early childhood, we can still get them as adults, but it is a factor. It's an important factor when we're comparing one person to the next person. Maybe they're both 40-year-old men, Black men, they both work full time, and they do the exact same job. But what's the difference between how come this guy ended up with high blood pressure and this guy did not? Sometimes it goes back to education. Food. Okay, I said you need to lose weight. I said I need you to exercise more. Well, in order to exercise, you want to have energy. And we can get our energy from food if we choose foods that are high in energy. But if you live in a place where it's very difficult to access not only healthy food, but healthy food that is affordable at a reasonable price. So that could be a regular grocery store. Every grocery store has sales. Could be a farmer's market. So we know that when people, particularly Black and Brown communities, tend to have more convenience stores, which are going to have just shelves full of processed foods that are high in sodium and high in sugar. And those foods increase our risk for high blood pressure and diabetes. It's going to make it very challenging, even if you live in a rural community. Excuse me, if you have to drive miles and miles to get to a hold on. If you have to travel miles and miles just to get to a grocery store, it's going to make it very difficult for you to meet that goal. When we look at what are our resources in the community, maybe you need assistance to do any of these things that I'm asking for. What stress is impacting your life that's having an influence on whether you can actually devote time to exercising and eating the right foods? Maybe you need a nutritionist, a social worker, a case management person. Maybe you just need a YMCA in your neighborhood or a social support, a group of like-minded individuals who want to go walking or have a 5K or host a food fair in your neighborhood. What resources are available? Do you feel supported? And so when we look at our healthcare system, there are some things that over and over and over, we're looking at the numbers. So is it accessible to you? Well, is there reliable transportation in that neighborhood to get to care? What about the hours? Are they convenient? Are they open early so you can go before work? Are they open late at night so you can go after work or on the weekend? Is there an emergency number you can contact? When you do get in contact with a healthcare provider, do they speak your language? Not only your language in terms of like English or Spanish, but also in terms of your literacy level. So what we're actually told is that, anytime we create content, it should be at the 5th grade level so that everyone can understand. And sometimes as providers, we do kind of forget that not everyone speaks our language. And so sometimes we use a gentle reminder to just to simplify the message. We look at quality of that care. When you go, are you going to be able to access all those specialty providers that you need? Particularly when people live in like rural communities, that can be really challenging. Sometimes they have to drive 1 to 2 hours just to get urgent care or emergency services. And then once they get to those facilities, sometimes they're being transported again to another facility that has specialty providers who might offer cardiology services or neurosurgery, or who have access to imaging or MRI scans. And that can happen in metropolitan communities too, particularly when we start to look at services for bariatric patients and things like that. So just to break it down, today we talked about what factors contribute to our health outcomes. What are those health outcomes? Well, you can see them at the bottom of the screen here. Mortality rate, that's another word for death and dying. Morbidity is another word for debility. So we know that when our patients have strokes, sometimes after having a stroke, they can't speak the same way, they can't move the same way. They might have deficits in vision or hearing. So how does disease impact your ability to function independently? What's your life expectancy? If you live in one neighborhood, you might have a life expectancy of the 80s. And if you live in another neighborhood, it might be something like 69 or 70 years old. And we know that there are outside influences that are contributing to that. And that because of that, we might be able to do something about it. Healthcare expenditures, how much we're spending in terms of money, cost, waste. Health status, when we look at the people in the community, are they thriving? Are they able to seek income and maintain that income? Do they feel safe? Do they have adequate law enforcement? Is there affordable and accessible housing? And then function. How are people able to have quality of life? Are they able to go about and do the things that they wish for and contribute to their community? So again, I thank you so much for watching. Our email is in the description box, as well as all of our social media links. This was one topic at a time, and I'll see you next time.